Welcome to our first study series entitled Intro to Pharmacology. So, what is pharmacology? Pharmacology is the study of medicines and how they work in the body. It is important to note that nurses bear most of the responsibility for medication teaching. Teaching should include desired effects, methods of administration, actions, and possible side effects. Moving on to understanding the client's rights. Before administering any medication, it is important to understand the client's 5 rights, which include the right to know the medication's name, usually the generic name, the right to know the medication's action, or the therapeutic effects of the medication, the right to know possible side effects. Clients also have the right to refuse a medication, and finally, the right to request the generic form of medication. Clients may ask for generic forms of medication because they are more affordable. Moving on to medication forms. Medications are available in several forms, which include liquids, solids, semi-solids, inhalers, and transdermal. Liquids can be administered orally or parenterally. Examples of liquid medication include syrups, tinctures, and parenteral. Parenteral administration will be discussed in further detail in later videos. Solid medication are administered orally. Examples of solid medications include pills, tablets, capsules, and troche, as well as powder and chewing gum. Semi-solid are usually administered by rectal, vaginal, or urethral routes. Examples include suppository, ointments, and creams. Inhalers are usually aerosol, such as a metered dose inhaler or powder inhaler. A nebulizer is a liquid medication that is also inhaled. Transdermal medications are designed to be absorbed through the skin. Examples include patches, creams, and ointments. Next, let's discuss prescribed medication dosage. A dose is a single amount of a medication administered to achieve a therapeutic effect. A therapeutic dose is the amount of medication needed to obtain a desired effect. It is important to understand the following definitions as they vary for all medications and want to prevent toxic and lethal doses. Up next, let's discuss the parts of a prescription. A prescription must include the client's full name, date, and time, name of drug, dosage, time or frequency of dose, method or route of administration, and most importantly, the provider's signature. Finally, let's cover receiving a verbal order. In emergencies, a provider may give a verbal order either directly or over the phone. There are a few important steps to keep in mind when accepting a verbal order. 1. A verbal order is not legal unless the nurse reads back the order to the provider. Reading back the order helps assure that the order that was written is the order that was intended. 2. After reading the order back, it must be documented as VORB. Verbal order. Read back 3. A verbal order must be co-signed by the provider within 24 hours. Now it is quiz time. Let's examine how much information we retained. Question 1. The nurse is administering a new medication to a client. Which nursing action should be performed to ensure the client's rights are adhered to? Select all that apply. Correct answers are C, D, and E. Remember, as a nurse, we ought to know the rights of a client before administering medication. Question 2. A nurse in the long-term care facility accepts a verbal telephone order from a provider. Which priority should the nurse take after receiving the order? Correct answer is C. It is important to remember, a verbal order is not legal unless it is read back. How did you do? Remember, you can always go back or review the material to better grasp the concept. Thanks for tuning in, and see you in the next video.